Welcome to the Health Line, issues that shape our well-being. I'm your host, Dr. Andrea Alt-Brutus. In the Health Line, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to have Fred Sganga, the Executive Director of the Long Island State Veterans Home at Stony Brook University. The mission of the Long Island State Veterans Home is to provide high quality and compassionate healthcare services for veterans and their families without regard to race, gender, religion, disability, age, or national origin. Fred, do you mind if I call you Fred?
No, please call me Fred. Absolutely.
Thank you. Welcome to the Health Line.
Andrea, thanks so much, and it's great to be here, part of Healthline.
Thank you. So tell us a little bit more about yourself, Fred, and how did you get involved in veterans health?
So I've been a healthcare executive for about 41 years. I have a bachelor's degree in community health from Hunter College, part of CUNY, and then I went on to Columbia University, where I have a master's in public health with a concentration in healthcare administration. My first 18 years were in the world of acute care, so mostly hospitals. But my last acute care gig was as president and CEO of Bergen Regional Medical Center in Paramus, New Jersey. A county facility, a governmental facility, a little bit different. It had a 600-bed nursing home, it had a 300-bed psychiatric hospital, and it had a 150-bed acute care hospital with a heavy emphasis on drug treatment. I always had my nursing home license, but I never used it, Andrea, for 18 years. Wow. And then all of a sudden, I was responsible for a 600-bed nursing home. I had a nursing home administrator there who reported to me as president and CEO, but I kind of fell in love with that aspect of care, not really knowing too much about it prior in my career. Out of the blue, I got a call from Stony Brook University, and they asked me if I'd be very interested in the position of executive director at the Long Island State Veterans Home. One of the other great things I've done is I teach here at the faculty at Stony Brook. I teach in the MHA program, and one of the things I always teach my students is if you're offered an opportunity to interview, always take the interview. Yes. You don't have to take the job, but you can take the interview. So I interviewed at Stony Brook. I became extremely fascinated that this 350-bed skilled nursing facility dedicated to our veterans was on a college campus. And that really got me going. They offered me the job, and I took the job, and it's been a dream for me ever since. Just celebrated my 23rd year there, starting the position back in February of 2001. Wow. So for me, being the executive director of the Long Island State Veterans Home, I'm not a veteran. After Vietnam and way before 9/11, but I am very patriotic. And I really have a special place in my heart for the women and men who have worn the uniform of the Army, the Navy, the Air Force, the Marine Corps, the Coast Guard, and now the Space Force to protect the freedoms we enjoy today. You know, one of the things I like to say in terms of my special population is that we actually care for the 1%. I think a lot of your listeners probably don't realize that less than 1% of the American population has served in our armed forces wearing the uniform. So, you know, for those out there who love their freedoms, you know, protesting, religion, whatever that might be, freedom of the press, we have a lot to thank for our veterans. And that's how I came to be at the Veterans Home.
Well, thank you for your service to our veterans. So thank you.
Thank you.
It's interesting, when I spoke to you earlier, you talked about the history of veterans' health. Can you tell our audience more about that history?
Sure. In terms of our United States government, we can thank, I call him number 16, Abraham Lincoln, but our 16th president was coming into his presidency at a very divided time in our country. It's harder to think that in the year 2024, anything could be more divided, but back in the day of Abraham Lincoln, we had this little thing called the Civil War going on. Believe it or not, between the Union Army up north and the Confederate Army down south, we lost about 1 million soldiers and sailors in that big battle. Wow. Lincoln came into office. He said, how do I reunite this country? How do I get us back on the right track? He did two things. He started the Veterans Administration, and that has grown. VA healthcare has grown to about 150 VA hospitals all over the country. But secondly, a lot of people didn't realize he started the State Veterans Home program. My home, the Long Island State Veterans Home, is not part of federal government. It's part of state government. And the way that worked is Lincoln said to the 50 states, If you want to do something right by your soldiers and sailors, Marines, airmen, the federal government, in terms of creation, will pay for 65% for the construction of the home if the state will match it with 35%. So that being said, that was the first home actually was built in Rocky Hill, Connecticut. It still exists. If you're driving on I-95 listening to this podcast right now in Connecticut, you're probably driving by there. But we've grown into a system of about 168 state veterans homes nationwide. Every state has a minimum of one home. Here in New York, we have 5 homes. The one in Stony Brook that I have the pleasure of running, but also there's one in St. Albans, Queens. Then there's one in Montrose, which is the Tarrytown, Sleepy Hollow area, and then 2 way upstate, one in Batavia, New York, and one in Oxford, New York. Nationwide, Andrea, we're about 30,000 beds, so we're the largest provider of long-term care to our nation's veterans.
Wow, great. I remember also when you and I spoke before, you talked about the different types of illnesses that veterans would deal with.
I'm not a doctor, so I want to put that out there, but every different war or combat or engagement has different issues that occur from that war. So, we talk about World War II, we talk about Korean War. Our World War II veterans and our Korean War veterans that are still alive are aging gracefully right now. But we've seen a big change with our Vietnam veteran population. So that was jungle warfare for some of our younger listeners who might not understand that. And the way we defeated the enemy was to eliminate the jungle. And the way you eliminated the jungle was the use of Agent Orange, which is a defoliant. The problem is if you were serving in Vietnam and you got sprayed with Agent Orange, that stuff went into your DNA at the end of the day. So we're seeing a lot of cancers. We're seeing a lot of neuromuscular illnesses, certainly in the areas of cardiology health and just in general. It's really been rough for that population. When you think about it, the starting age group for entering into a nursing home should be around 85, 86 years old. And we have our Vietnam veterans who started hitting the nursing home world in their early 70s. The current age of a Vietnam veteran is probably mid to late 70s right now. And I can tell you that my home is 350 beds, and half the home is Vietnam veterans.
Wow.
Yeah.
Wow, interesting. So tell us more about the Long Island State Veterans Home at Stony Brook University. I understand you have a skilled nursing service and an adult day health care. Can you tell us more about both programs?
Sure. So on the skilled nursing side, we're a 350-bed nursing home, also known as a skilled nursing facility. We do short-term rehabilitation. So if the veteran's getting a knee replacement, hip replacement, maybe some open heart surgery, and they need a week or 2 to recover, we serve in that capacity for the veteran. We also do traditional long-term care, and we're very pleased to tell you that we probably have about 15 or 20 World War II veterans who we're still caring for. And we do have one D-Day survivor veteran still with us, 100 years old, going strong.
Wow.
And this past June 6th of 2024, we celebrated the 80th anniversary of D-Day, and this veteran was with us, and I expect him to be here at the 85th anniversary too, so he's in good shape. We also do Alzheimer dementia care, so those with memory loss, we can help them as well. And one of our big elements is hospice, end-of-life, and palliative care. For all our listeners out there, whether your veteran needs 6 months, 3 months, even 2 days, we think that, Andrea, most people will try to keep their loved one at home in a death and dying situation. I think it's fair to say that we all want to die in our own bed, but some families just can't handle that at the end of the day. So for those listeners out there with veterans and their families, whether it's short-term rehab, traditional long-term care, Alzheimer dementia care, or end-of-life care, we're there to serve you. Just give us a call. 631-444-VETS, VETS.
Thank you so much for sharing that.
Great.
And I understand with the adult day health care,
Yes.
you utilize a medical model. Can you tell us more about that?
Sure. So we have medical model daycare. Our program is 6 days a week, runs from Monday through Saturday from 9 a.m. to 3 p.m. And what medical model adult day health care tries to accomplish is to provide all the services of a skilled nursing facility. But here's the kicker. The veteran gets to sleep in his or her own bed that night. So we let the veteran keep their doctor in the community, whether it's a private doctor or if they receive VA health care, let's say here in our case, VA Northport Hospital in Northport, Long Island, the veteran keeps his or her doctor. And we work with the staff to provide those medical model services. The difference between social model and medical model is as follows. Social model is breakfast, lunch, and a lot of bingo. Our model is breakfast, lunch, some bingo, but we're providing some of the day-to-day medical services you might need to keep you out of the emergency room, to keep you from being hospitalized. It could be a nebulizer treatment. It could be a wound care treatment. It could be medication management, all those kind of things. We're doing it right at the home. And then that veteran gets to go home 3 o'clock at the end of the day and spend the rest of the day with his or her family.
Nice. And I understand that there's interest to replicate this model across the country?
Yeah, so I had the great pleasure back in June of 2024. I was asked by a joint session of the United States Senate, both the Aging Committee and the Veterans Affairs Committee. I received a call from Senator Mike Braun from Indiana, and he had heard about our program and was a little upset that his state veterans home in West Lafayette, Indiana, didn't have the program. Mm-hmm. So I was called in to testify. And sadly, while we have 168 state veterans homes nationwide, only 3 of us are in the medical model adult day healthcare business at this time, or service. I don't like to say business. It's ourselves, Minneapolis, Minnesota, and Hilo, Hawaii. We have hosted probably about 10 or 12 homes in the last 2 years or so, where they're coming to see our best practices and seeing how we operate. It's a great service. The big deal is it's a great service for your family caregivers. So let's think about this. Andrea, your dad, let's say if he was a veteran, let's say he was, in his late 70s, early 80s, he comes to the program. Here's what I can do in the course of a 6-hour day. I can change the battery in his hearing aid. I can have his teeth cleaned and maybe a cavity filled if that's what he needed. I can have his eyes examined by our optometrist. He might need some physical therapy, some occupational therapy, some speech therapy, phlebotomy, because the doctor says, hey, it's time to check the bloods, get specimens. We could do that. We can provide simple x-rays at the home as well. And lastly, he might need a haircut, and we can get that done too. So when you count all those things I just mentioned, that's 9 separate trips I've saved you in the community. Think about the 85-year-old veteran who's got an 83-year-old wife. She doesn't have to drive him all over town. Or that veteran could be a widow, and now you have the kids who are helping out, providing that kind of caregiving type service. So we've been a real lifesaver. I think the downside for us being on the campus of Stony Brook University is that a good medical model daycare program, you must live within a 1-hour drive time. So for us, we can kind of go to the Nassau-Suffolk border, and we can go as far east as Riverhead, again, based on traffic, in terms of getting there within 60 minutes or so. That's the challenge.
Why do you think it hasn't been replicated more throughout the country?
I think that when we did it, our home opened in 1991, and then a few short years after, we decided to get into that programmatic area. I think you have to have a gumption to just do it at the end of the day. And we just did it. We had the space. We had the equipment. We had the people. We had the leadership at the time. I can't take credit for it. I didn't arrive till 2001. But we just did it, and it's been very successful. I know we're going to probably lead up to entitlements and benefits, but I want our listeners to know that if you do know a veteran, that every veteran is entitled to $144 a day towards skilled nursing care if they stay at a veteran's home anywhere in the nation. But there's also a benefit for daycare as well, and that's $110 a day towards the visit of daycare. Doesn't pay for everything, but it pays for a substantial amount as well. The other key point that I really want to get out to your listeners, and this is a very big deal among our Vietnam vet population, if you know a veteran who is 70% or more service-connected disabled, their care is provided by the federal government at no cost. So this is a very big deal. I can tell you that we passed that law back in 2017. I worked with Congressman Lee Zeldin at the time, and Lee got elected to Congress 2 days after he got sworn in D.C. He was sitting in my office, and he said, hey, I'm on the House Veterans Affairs Committee. What can we do to make the lives of veterans better? I said, Lee, if a veteran in our country is rated 70% or more service-connected disabled, she or he will get no-cost nursing home care. I said the same rule does not apply to those people who are attending medical model daycare. So we did something about it. I wrote a white paper with my colleague Jonathan Spear, who's also a Hofstra graduate and serves as my deputy executive director. Believe it or not, we found sponsorship both in the House and the Senate for these bills. Lee and Kathleen Rice at the time, who also was sitting, became very bipartisan. Lee was a Republican, Kathleen Rice was a Democrat, and they introduced it in the House. And then it got the attention of Orrin Hatch in the Senate. May he rest in peace. But he was from Utah because our colleagues at the Utah State Veterans Home were in the strategic planning stage of starting daycare as well. That being said, President Trump signed it into law 13 months after it was introduced.
Oh, great.
Which is unheard of in terms, nothing gets done today in Congress. And at the time to get a bill passed in 13 months. But here was the best part for me. When the bill got passed and the VA, which took a little bit of time, implemented the law, 6 of my veterans who were in the nursing home got discharged.
Wow.
Okay, these guys were all 100% service-connected disabled. And the reason they were in the nursing home is that their families had no other options. Now they have this new law, okay, public law, I forget the number of the law, but they all went home and they all came to daycare. Some came
Amazing.
4 days a week, some came 6 days a week. And we were able to provide all the same services that they received in the nursing home. But, they got to sleep in their own bed at night and be with their families, which I think was most important. So it is a great program. I'm pushing hard nationwide. I'm hoping to ease up some more restrictions in the 119th Congress. We serve as a great role model, and, we want to help our veterans. They deserve it.
And do you find that most veterans know about the benefits that they're entitled to, or no?
We have a motto at the home that says if you can put 3 or more veterans in a room, even if it's out in Montauk Point, we'll make the trip to educate our veterans about their benefits. That's the least I can do as a beneficiary of my freedoms. When I started, believe it or not, in 2001, there were about 200,000 veterans on Long Island. You may not know this. There are 62 counties in New York State, but Nassau, Suffolk rank number 1 and 2 with the most veterans in our New York State population. Nationwide, we have about 16 million or so veterans. New York State, we have about 800,000 veterans. Nassau and Suffolk County, the 2 counties, we have about 80,000 veterans left. While the number has gone down since I started my job 23 years ago, what has gone up is the age group of these veterans. So 65% of the 80,000 on Long Island are older than 65 years of age. Now, I'm in the long-term care business. It's good for me, in terms of the numbers, but I worry down the road, too, what's going to happen with our veteran population. It's shrinking, and I think that's a sign of the economic times. I think a lot of our veterans have left New York State to retire to other parts of the country. They're building new state veterans homes in Florida. They're building new state veterans homes in Texas. I think that's where the shift has been.
Yeah, that makes sense.
Regionally.
Okay, great. You talked about Lee Zeldin, and that era was pretty much kind of going into COVID-19.
Oh, yeah.
What was the impact of COVID-19 on veterans' health and the work that you do?
I think veterans took a big hit, especially with the older population. Thinking back to COVID hit our home back in March of 2020. Actually, it happened on March 20th of 2020. I think nationwide, a lot of state veterans homes saw a lot of deaths at the end of the day. Part of the issue in Suffolk County was that we ranked number 3 out of the 62 counties with the most COVID. Brooklyn and Queens, 1 and 2. Suffolk, which hard to believe, was number 3. And a lot of my employees lived with multi-generational families. So it was hard to keep out of the home. I think while we had significant loss of life, I didn't lose a single employee. And that was very uncommon in the healthcare arena. And I think that was because with everything that the global pandemic hit us with, we were prepared when it came to having the proper PPE. A lot of us probably don't remember. Nursing homes will last on the list to receive PPE. Yeah. It was the first responders, it was the hospitals, and then maybe if we had something left, we'll send it to the nursing homes. And in retrospect, they should have been the first ones to get all the PPE. So it was a tough time, but I think the good news for us is that we got through it. And we had to deal with some other controversial issues. There was the vaccine mandate in New York. So on September 28th of 2021, believe it or not, I lost 36 caregivers in a single day.
Wow.
So we had to think quick on our feet on what we were going to do. I know this is not on TV and this is a podcast, but my nose is a little larger because during the period of COVID, I must have had 500 to 600 COVID tests during that 4-year period. So it was a lot of stress. It was a lot of strain. I think we got through it. At the time, I was probably 62 years old. And families would come up to me and say, hey, what should I do? Should I take Pop home? And I said, I've been a healthcare executive for 30-something years, but this is my first global pandemic. So we didn't know what we didn't know, but we got through it.
And I remember when you and I talked about how you entered into a field of like telehealth, for example, and home health care. Can you tell us more about that experience?
Yeah. So we talked about medical model daycare, where somebody comes and spends a 6-hour day with us. Governor Andrew Cuomo at the time suspended all daycare throughout the state of New York. So I had about 75 people in program. Some of them, live by themselves. And we said, what can we do? How do we switch gears? The one good thing about pandemics is that they give freedom to certain agencies in government, in this case the VA, to pay for things that they don't need bureaucratic approval. So I reached out to the VA and I said, listen, I want to do 2 things. I want to start telehealth communications. So we set up most of our registrants who could handle it with iPads in their own home. And then we did meal deliveries. We did PPE deliveries. We continued with vital sign checks. We continued with vaccinations if they were available. And we wanted to stay connected with those who we were responsible for at the end of the day. I must say the VA came through 100%. They made sure that we received proper reimbursement to do that. And we did stay connected during what was a very tough time, thinking back to the global pandemic.
Well, I could talk to you all day, and unfortunately, we have to wrap up soon. Since we're in November and Veterans Day is upon us, what are your thoughts that you'd like to leave with the audience about veterans' health?
Here's one of the funny things we say at the Veterans Home. If you work at the Long Island State Veterans Home, when you go home at night, you do not watch the History Channel because you get that all day long at the home. The number of stories that I've heard in my 23-year career there, when I started, I had World War I veterans in the home. Now that I had the good fortune of meeting many World War II veterans, Korean War veterans, certainly the Vietnam veterans. We've had a few Gulf War veterans at home. And I think back, 2 things I think of immediately. One is that some of them got drafted. They didn't have a choice. But a lot of them are actually volunteers and have volunteered to be in the armed forces. So when they come home, and, I never, ever, ever, ever want to take anything away from a veteran. Anybody who puts their life on the line to protect our country, our freedoms, and our way of life, man, we owe them a debt of gratitude. So with Veterans Day upon us, to all the veterans in the listening area, just, you have all our thanks. The home consists of about 600 employees. I have about another close to 300 volunteers, many of them veterans. And we will do everything in our power to make sure that those veterans who need long-term care, that we're going to be there for them and we're going to exceed their expectations.
Well, thank you so much, Fred. It's been such a pleasure having you here.
Thank you.
On our podcast. And just thank you for the work that you do for our veterans. Also want to say thank you to those veterans who are listening to the podcast today, and thank you for your service and your sacrifice for our country. So I want to thank our entire audience for joining us today on this episode of The Health Line. And as always, we appreciate you tuning in. My name is Dr. Andrea Alt Brutus, and have a great day.